Welcome to Your Family's Health, the program that focuses on healthcare issues with unique and different modalities for taking charge of your health today. Experts talk weekly with our continuing roster of guests from around the country and right here in Nassau County to keep you up to date on the latest health issues and trends. Take care of your mind, body, and soul. Spend the next half hour with the voice of Nassau Community College, 90.3 WHPC, and get on the journey to better health.
Hello and welcome to Your Family's Health. My name is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College. And today you're going to learn about healthcare price transparency, knowing how much a health service is going to cost before you actually have the service performed. What is being done to keep everything on the up and up? My guest today is Cynthia A. Fisher, a life science entrepreneur, independent investor, and corporate board director and founder of Patient Right Advocate, Inc., a non-for-profit with the mission of supporting price transparency models. Cynthia, welcome to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. Welcome.
Thank you, Dr. Jeanine. It's wonderful to be here today with you and to talk about my favorite subject, which is enabling all consumers of healthcare to know prices before they get care so that they can save their own money and choose to shop for the best quality care at the lowest possible price.
So what a great resume you have. And tell us about how you wound up doing what you're doing in your career path, your connection with health.
I have been in healthcare throughout my professional life. I started with IBM, where I automated hospitals and insurance companies to communicate with each other on the files that they transferred. And then fast forward years later, I got my MBA and started a company after working in blood and bone marrow transplant. I started a company called Viacord that banks umbilical cord blood stem cells. And when I started that company 30 years ago, from the very beginning, we were price transparent and quality and outcomes transparent. And that company still exists today. I've sold my company. However, it's still price transparent and charges one price, one patient, all patients. So that I know can be done in healthcare because as an entrepreneur and former CEO, I did it myself. What brought me to found patientrightsadvocate.org and go to Washington and bring the voice of the voiceless? That's all of us who actually receive healthcare as patients and as Americans. I went to Washington founding patientrightsadvocate.org because I saw too many people had been devastated by medical bills they never expected to have to pay, the prices, the outrage, and every medical bill is a surprise if you don't know the price before you go. And so I went to Washington and philanthropically have put monies into this organization to find where in existing law we have the right to know prices and the right to quality information before we get our health care so we can lower the cost of healthcare, which has just run away in the past 2 decades, being sky high and really being a detriment to American paychecks, wages, and savings. And ultimately, we found that there were existing laws. They just had never been made into rule of law. And thank goodness it's 3 presidents, Obama, Trump, and Biden, have weighed in to support healthcare price transparency, making hospitals actually show all of their prices online, now by law since January 1st, 2021. And unfortunately, only 16% of the hospitals in this country are complying with the law and posting their prices online for consumers to see.
So why is healthcare pricing so confusing? I know that I might go to one anesthesiologist and in the local town near me and go to Manhattan and it can be a completely different price. Why is this so confusing?
Well, the prices have been kept in the dark. When patients and employers who purchase health insurance have no idea what prices are in advance of care or in advance of selecting an insurer, well, hospitals and insurance companies can charge whatever they want. And in fact, when you cut out the consumer from being informed, so many overcharges have taken place that the incentives that hospitals have is to put profits over patients. And in fact, they even have whole organizations called revenue cycle optimization management. That means charging as much as they can for a patient's encounter. So to talk about anesthesiology, for example, the sad thing is that the longer a patient is anesthetized, the more money the hospital makes. Well, the most efficient surgeons and the most efficient anesthesiologists would be efficient and provide better quality at a much faster time. And that would lower the price of care. So when you bill per minute of anesthesia, well, it is a perverse incentive to charge more. And that could be a detriment to a patient's health. But moreover, what we've found now that these healthcare price transparency laws are in effect is healthcare price transparency is so transformative. Why? Because knowing the prices shifts power to the patients to be able to shop and also to prevent being overcharged or fight an erroneous or fraudulent bill.
So, for example, if I know that I can anticipate a surgery that I know I have to have, maybe an appendectomy or maybe a removal of a gallbladder or whatever, is there a place that I can go to know what is the range, the standard pricing for this surgery? Is there a place to go? And where do I go for that?
All hospitals now are by law required to produce all and post online all of their actual prices by every procedure clearly named in every code and listed by every insurance plan and health plan that they accept in their hospital, as well as the discounted cash price if somebody wanted to pay cash, which sometimes it's 40% lower than the lowest negotiated rate. And hospitals now are supposed to post it online. Well, it's kind of clunky because this is the beginning of a revolution of transparency that technology developers are just now getting access to these prices. And so they're starting to parse through them and be able to provide comparisons. And what we're finding from the early technology developers, which hopefully soon, once all of the hospitals are forced to comply by the federal government, because there are civil fines of up to $2 million per hospital for not showing their prices, is once the hospitals comply with this law, then the technology developers could, in fact, produce mobile apps like we have for shopping for airlines, right? And so if you or I wanted to find where could we get an MRI at closest to us, or say within a 50-mile radius, and where if we're willing to pay $300 for an MRI versus $3,000, which might be in an opaquely not showing priced hospital, then we could simply do a Google search to go shop online to say who's available and at what price to get MRIs for that patient. And we could compare our plans compared to other plans at the same facility and refuse to be overcharged. So only in seeing all of these prices, and they vary widely, even in the same hospital, Jeanine, it was reported that in the same hospital, that one woman paid a little over $6,000 for her same coding, the same medical team for a C-section, a little over $6,000. And another woman's health plan, she paid over $60,000. So a 10 times difference from the same hospital. And this is happening every day across our country. You know, none of us would accept paying 10 times more for a gallon of milk if we stood in the grocery line than the person in front of us. We just wouldn't tolerate it. We'd ask for the same fair market price. And that's what's going to happen in healthcare once these prices get the great reveal.
So when we talk about pricing, the $60,000 versus the $6,000, is that taking into consideration the insurance that's going to be responsible for a portion of this pricing? Or is that just looking at the procedure itself? Am I factoring in my insurance or I'm not factoring? How does this price list work?
That pricing in the standard charges file is to be posted by every insurance carrier and every plan. So if you and I were going into the same hospital and we had different health plans, or we wanted to pay cash, we could look across a column and be able to find the price that you would be charged versus I would be charged. But what's outrageous is today, some women are paying 10 times more for childbirth with their insured plan. And even some of those plan insured rates are 60% higher than if one would to pay straight up cash and so part of that portion is whatever one's copay or co-insurance is. But let's be real. All of this healthcare is the American worker pays for all of it, right? It comes out of our paychecks because we share by having automatic deductions from our paychecks pay for our health benefits. And then we share in the cost with copays and high deductible plans. And then on top of it, we pay taxes. And our taxes pay for Medicare and Medicaid for other people to get coverage. So when you think about the runaway cost of healthcare, and in New Jersey, just last week, the police union saw a 24% increase, 24% in their health plan costs. Well, their wages didn't go up 24%, but their insurance health benefit went up 24% just this year to next year. So they were actually protesting in New Jersey because of meaning it's taking out of their take-home pay. In these inflationary times, hospital prices are far higher than inflation.
Wow.
And it's criminal.
It is.
Because it's greed. You know, if hospitals aren't showing their prices, and most of these hospitals 20 months in are not complying with the law, especially New York hospitals. Only 9% of New York hospitals are posting their prices. And it's the biggest centers like New York Presbyterian, Langone. They're not posting their prices online so that a market economy can be established and all of us can be able to find a fair market price for an MRI, a colonoscopy, or childbirth.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today you're learning about healthcare pricing transparency. Knowing how much a healthcare service is going to cost before you actually have the service performed. My guest today is Cynthia A. Fisher, a life science entrepreneur, independent investor, and corporate board director, and founder of Patient Rights Advocate, Inc., a non-for-profit with the mission of supporting price transparent models. So I have to ask you, when it comes down to most Americans, they don't even know the true cost of healthcare because the insurance companies often are paying their bills. Mm-hmm. Does this pricing transparency affect at all the insurance companies?
Yes, it does. In fact, as of July 1st of this year, every health insurance company now has to post all of their prices too that they've negotiated with every care provider. All of the hospitals, as well as anyone else, like a chiropractor or a physical therapist, wherever they cover care, the insurance plans by every employer are to post online on the employer's website all of the exact prices that they've negotiated. And again, this is the very beginning for technology developers to get access to this information and start to create comparative shopping tools. And it also is to give all of us the ability to fight an erroneous overcharged medical bill if we see that the cost of MRI might have been charged $5,400 versus $300. Then we can stand up for our rights to be able to be credited for overcharges, because however we share in those costs, it's our money and it's our health. So this is a very transformative time in healthcare.
So we're looking at, since this is a law, and if I am overcharged for a surgery or anything that I may, any practitioner procedure, what is my standing in the law? You know, can I sue for probably being overcharged for a procedure? What leg do I have to stand on legally?
Well, I think one of the things is that people have the right to reach out to the hospitals and their insurance companies and let them know they've been overcharged. And in fact, we've found that even in hospitals that aren't posting their prices, when we can see other hospitals and we can see what a fair market price is, we can then go forward to that hospital and show that we have been and egregiously overcharged. And in fact, you can fight those medical bills. We knew of a young man who was charged $15,000 for an EpiPen from the hospital. And the insurance negotiated down to a $4,900 rate. Well, he had a $5,000 high deductible plan. So he was going to be responsible for all of that. But this poor young college student did not have $5,000 and knew that it was a way overcharged. There had to have been some kind of issue here. So he was able to go online and find the price that was negotiated at that hospital, which was only $300. But still, it's pretty relatively high, because had he gotten a prescription and gone to a drugstore, he would have gotten it for $70. Right. But he ended up seeing that it was $300, printed it out, attached it to an email, and connected it to an email and sent it to the CEO and the CFO of both the insurer and of the hospital. And they basically credited his whole claim and said, we made a glitch. There was a glitch in our system. So both the insurance company and the hospital overcharged him, and he was able to show proof.
So during the pandemic, I think you were very outspoken against hospitals getting bailouts from the government and not posting their prices. What has changed as of now, after COVID is kind of gone down? What has changed? Or has there been any change since COVID?
Sadly, the hospitals have stalled complying with this law. Our first report 6 months in was 5.6% compliance, which was pathetic. The next report we did 6 months later, in January of this past year, we saw 14.6% compliance. We looked at 2,000 hospitals just this past month, and we found that only 16% were complying. We're 20 months into this being law. And unfortunately, Secretary Becerra at HHS is not enforcing the law, but he's been very generous with hospitals. They got $200 billion in bailouts, New York being among the highest of bailouts. Now, these hospitals have huge endowments, and they're not for profit, but they are actually profiting. They're profiting in amazing ways. And the reason is that they can charge whatever they want if they don't have to compete against other hospitals on quality and price. So they're really harming patients. And most of, the doctors and the nurses have a Hippocratic oath to do no harm. We're not actually arguing about the doctors and the nurses, because they've done extraordinary work to save lives and are in the front line every day to provide the best care. It is the big business of hospitals that now are really looking at maximizing their profits and disregarding the law at the expense of their patients. And so they've lost trust. They've really lost trust of the consumer. And I can tell you that when 64% of the people across this country delay care for fear of financial ruin, well, we are having a less healthy populace because we delay care because we don't know if we can afford it. Even if people have coverage, they've been surprised with overwhelmingly outrageous medical bills, giving 100 million Americans into medical debt in this country. So it's game over with price transparency, because that is the initial launch of shifting the power to patients to be able to save and for us all to benefit from competition. But they're delaying the game by not complying with the law. Our report, Jeanine, though, in our report, we saw 2 hospitals were fined over $1 million in Georgia for not posting their prices by HHS. And within 2 weeks, we saw them post wonderful files online, allowing any of their patients to find their prices. So we know enforcement from this study works, enforcement with civil fines, and we would look to the New York hospitals and the New Jersey hospitals to be fined from Health and Human Services, because they're really harming the citizens by not being able to getting access to the care when they need it at prices they know in advance that they can afford.
What I'm wondering is, will hospitals be able to apply for hardship waivers or exceptions to meeting the hospital price transparency requirements? Are they going to be able to get to kind of have pushback?
Well, the hospitals have pushed back by simply not showing their prices, and they advocate with thousands, I'm talking thousands of lobbyists in Washington to protect their self-interest in making money as much as they can. And, we've seen such consolidation with hospitals, During the pandemic, it was record number of mergers and acquisitions, making them richer and richer. I mean, look across this country. Where are the building cranes? Hospitals. Where are the billboards? I just landed in the airport here, and you see hospital after hospital advertising and on the news at night. This used to be good old consumer brand marketing companies, but no, who's advertising? Well, if they're really nonprofits, why do they need to advertise?
Yeah, right.
They should be saving all that advertising budget and putting it into lower prices and better care.
You're listening to Your Family's Health on the voice of Nassau Community College, 90.3 WHPC. My name is Dr. Jeanine Cook-Garard, and today you're learning about healthcare pricing transparency, knowing how much a healthcare service is going to cost before you actually have the service performed. My guest today is Cynthia A. Fisher, a life science entrepreneur, independent investor, and corporate board director and founder of Patient Rights Advocate, Inc., a non-for-profit with the mission of supporting price transparency models. So I would ask this question to you because this is something that I've always wondered. Now, when it comes down to, you said advertising, one hospital may advertise something and another hospital may advertise something else. What is your group doing to educate the hospitals and to assist them with this compliance transparency? Are you helping the hospitals, or are you helping the patients and the healthcare, the population? Or are you in between, kind of doing both? What does your company do?
Our mission, we're a nonprofit and we're a philanthropic organization, and we have no interest in the healthcare sector other than to see the entire sector lower the cost of healthcare for all Americans and provide better quality of care and better outcomes by competing and being transparent about all prices, all fees, all quality and outcomes. Then we can have a real market in healthcare. In today's world, the consumer has been ill-informed or not informed. Just try to find a surgeon. How do you know how many surgeries they did or what their infection rate or readmit rate is? Well, all that information should be transparent and public.
Yeah.
So the surgeons should have to compete for our trust and our care.
So you're really a patient right advocate. You're a patient right advocate. You're there for that patient and to make sure that they are charged the correct pricing.
And get the best quality of care.
Yeah.
And get access to care, because so many people don't get access to care, and they're fearful of financial ruin, so they delay it.
Yeah.
So when we can have transparent prices, transparent quality and outcomes, transparent availability, then there's no reason why, just like shopping for a flight, we can't be able to go online and shop for who's accessible and at what price and what type of outcome I should or you should expect from getting an appointment or seeking care. So this is game changing, because who would pay $3,000 for an MRI when they knew they could get the same quality of an MRI for $300?
Right.
And every day we're doing it because we're blind to know these prices. We get blindsided by oftentimes outrageous overcharges. For instance, in some of these hospitals here in New York, you can get a $3,000 MRI, but then you get slammed with an $800 facilities fee for walking in the front door. Mm-hmm. What's that all about?
Right.
That's just a way for them to upcharge and upcode the patient and make more money. But if I go to a standalone MRI clinic, imaging center, I don't pay a facilities fee, save those $800. And then demand to know what the cash price is. Because we've seen, even in states across this country, prices as low as $250 for an MRI. Well, that makes it affordable when someone has financial certainty that they're not going to be charged anything more than what they're quoted up front.
Yeah, I was going to ask you that about, are hospitals allowed to do a cash discount? If I have $200 in my hand, can I call and barter for a price on a particular procedure? And who do I talk to in the hospital? Do I call and speak to, who do I talk to about that?
My own personal experience is I broke my hand. I got an MRI for $300 in Florida. It was $4,500 quoted at Mass General in Boston where I broke it. So I was on an airplane to Florida that day. I just thought I'll go to Florida, and I found a standalone clinic for $300. So I saved the money, got an MRI in a timely amount, and got a great read. And then I needed a hand surgeon. Went to the hand surgeon, found that was going to cost me $850 just to see him. And I asked, how much would it be if I paid cash? Well, he said $200. Well, my husband and I own the company, so we're self-insured. So I said, I'll pay $200 because that's our company's money.
Right.
So I got the hand surgeon for $200. Then I needed a cast brace that was Velcro on, and he had it in his office. My insured rate was $185 for the brace. And he was so curious because I had pushed cash so much that he said, well, let's look up the cash price on Amazon.
Wow.
We took the same model number. It was $16 on Amazon.
Wow.
Way. So I got the brace on Amazon, but because I wanted one right away, I said, what will you charge me cash? He looked at me and said, how about 32? Mm-hmm. I said, okay, sold. I'll buy it for 32. Wow. And I'm saving my company and my husband and I $185.
So you were talking directly to the surgeon when you were doing this negotiation?
Yeah.
Wow.
Talking directly to the surgeon.
Okay.
And I also talked directly to the staff members.
Mm-hmm.
And not many people do that. So the staff members basically have gone, well, I don't know what our cash price is.
Right.
So they go back and they ask. But, you know, the American dollar bill says on it that it is a unit of treasury for all Americans. It cannot be denied. And look, when the hospital or the doctor sees you and takes cash, they're getting paid right away. They don't have to pay for office staff to go administer and hound the insurance company and wait months to get paid, right? They get it right away. And so it's much more efficient to them to be paid cash. And that's why discounted cash prices are typically lower than the insured rate.
Such important information. How would we get in contact with you?
You can go to patientrightsadvocate.org.
Priceless information. Thank you so much for being here. Cynthia A. Fisher, a life science entrepreneur, independent investor, and corporate board director and founder of Patient Right Advocate, Inc., a non-for-profit with a mission of supporting price transparent models. We hope you stay safe and continue to stay healthy and continue this great work that you're doing.
Thank you so much, Jeanine.
This is Dr. Jeanine Cook-Garard from the nursing department here at Nassau Community College, and we want to thank you for listening to this week's edition of Your Family's Health.
We'd like to get your feedback on your family's health. Send your comments by emailing them to whpc@ncc.edu. Podcasts of today's show are available on iTunes, Android Podcasts, and Spreaker. This program was produced at the studios of Nassau Community College in cooperation with the nursing department. Join us next week for another edition of Your Family's Health on the voice of Nassau Community College, 90.3 WHPC.